I'm going to my topic, comparison of visceral fat distribution and metabolic age in CAD patients. So myself is Deepak, and I'm going. My guide is Deepali Vidhate, and I'm come from Dr. D.Y. Patil Medical College in India. Okay, so so my topic is the metabolic age. So metabolic age is served as emerging marker for metabolic health. Okay, so it describes overall fitness and metabolic activity of the persons. So lower metabolic age than actual age implies that the body is in a good health, while when you compare with the metabolic age in higher than the actual age indicate that the subject may experience in health problems. Okay, so how will you calculate your metabolic age? So it is comparison between the person metabolic basal BMR, basal metabolic rates, so against the average.
Sorry to interrupt you, sir. Could you make your slides bigger slides? The slide is not properly visible.
Oh, wait a second.
Now it's fine.
Yeah, you can see my slide, no?
Yes, yes, sir.
Okay, so BMI, which is calculated by the person basal metabolic rates against the average BMR, which is metabolically fit subjects of the same age. So metabolic age reflect person health, physical health, and it is calculated on the basis of the BMR, basal metabolic rates. So in recent study, it has been observed that a group of CAD patients show is higher metabolic age. So age is one of the major risk factor associated with CVD, cardiovascular disease. About 1/5 of the world populations will be age 65 or older by 2030s, with the exponential increase in CVD prevalence. It is well established that the environmental factors like overnutrition, smoking, pollution, sedentary lifestyles may lead to the premature defects in the mitochondrial functionality, insulin signaling, endothelial homeostasis, and redox balance, fostering early senescent features. So adipose tissues is a typical location for the storage of a fat. Okay, so you can see here slides in the obese patients, or in obesity is associated with increased the morbidity. It depends on the age and sex. So abdominal adiposity, so as measured by the waist circumference, is a significant predictor of the morbidity or mortality independently of BMI. So visceral fat is a strong independent predictor of the dyslipidemia, and insulin resistance. Change in the visceral fats are associated with concomitant changes in the glucose tolerance, like the insulin resistance. Okay, then visceral fat is a main offender in a setting inflammations. It is a key feature associated with the atherogenesis instead of just a fat storage sites. Now, visceral fat is considered as a risk factors than overall obesity. The risk of the CAD, coronary artery disease, increased dramatically with the increasing age visceral fats. So these are fat that surround the vital organs in the body. So high visceral fats level increase in the risk of high blood pressures, heart disease, and type 2 diabetes mellitus. Okay, so here is a body fat analyzers. You can measure your visceral fat. There is a scale. If the scale is range between the 0 to 10, that means the patient is at the healthy. It's about 12 to 59, that means it is a higher chance of the visceral fats too. It indicates the excess level of the visceral fat, means it is making changes your diet, increasing the amount of exercise you do. Okay, so that is the body fat analyzers. We can measure visceral fat, metabolic age, then muscle mass. You can anything you want muscle anything muscles you can measure. So there is a sex hormone is one of the hormones to measure the determining the fat distributions. Like the obesity, there are the two types of the obesities. Okay, classification fat distributions. First is android types and gynoid types. So this visceral fat is not identical to the android types. Visceral fat accumulation is more predominant in a male than a female when compared in age matched obese patients with similar BMI. Aging is also very important factors to promote visceral fat accumulations. So in male, there was a close linear correlation between age, visceral fat volume, suggesting visceral fat increase continuously with age. Okay, so you can see here the visceral fat is a metabolically very active, releasing free fatty acid into portal circulation, which goes into the liver directly. So excess free fatty acids may cause enhancement of the lipid synthesis in the liver. So it may lead to insulin resistance, resulting in a hyperlipidemia, glucose intolerance, and hypertension, and finally atherosclerosis. Okay. So this study, which is included in the 45 CAD patients and 39 control subjects, we also anthropometric measurements recorded manually. Body fat analyzer used to measure visceral fat, metabolic age in the both study group, and the reading were repeated thrice for the getting a maximum accuracy. Okay, so my aims, the present study was to evaluate some of the association between visceral fat and metabolic fat in the CAD patients. So my objective are to determine metabolic age by body fat analyzer in a both CAD and control groups, to evaluate visceral fat on a body fat analyzers in a CAD and control group, or to compare the association of metabolic age and visceral fat in a CAD groups. Okay, so this one is the result. The study observed in an increase in visceral fats in the CAD patient as compared to the control and CAD. So you can see here in the variables, there is a metabolic age and visceral fat. So we can compare with the controls, the CAD patients, the metabolic age of the CAD patient is high when you compare with the controls. Same thing happened in the visceral fats. The controls of the healthy patient is a 9.15, and when you compare with the CAD, it is slightly high. So discussions, so you can see here the significance difference was shown in the metabolic age CAD and control respectively. So, and significance difference was shown in the visceral fat CAD control respectively, as visceral fat 10.8 to 9.15, and my p-value is 0.01 is a significantly high. So now it's coming to the last point is the conclusions. This finding underscore the importance of setting abdominal obesity as a primary target for the obesity reductions, and consequently the need to educate healthcare practitioners on the importance of the routine measurements of visceral fats. And the present study concluded that visceral fat and metabolic age were increased in CAD patients, and a strong correlation was also present between them. So these are my reference. Thank you. Thank you so much.
Thank you very much, Deepak, for your very good presentation.